candidates will pledge, if they're elected, to improve the quality of healthcare in Watford? And so the first part of the question is how would you do that? And the second part of the question is where do the candidates stand on the proposed Watford Health Campus project?
Thank you very much. Max,
Yes, certainly. I think that the issue of healthcare provision in Watford is inexorably linked to what you're seeing going on around the country. And that is largely down to the fact that the Health and Social Care Act has been an unmitigated disaster that means that even doctors and nurses are saying that the NHS can't survive another 5 years of Tory and LibDem government. Clearly, locally, targets are being missed, A&E waiting times are up, ambulance turnaround times are up. It's very difficult to get an appointment to see a GP within 48 hours. The Health Trust itself is £14 million in debt, and it's largely in debt because it needs to rely on agency nurses because its nurse-patient provision is insufficient. Now, of course, the Trust is doing the right thing and putting patient healthcare first. So what we will do is inject 20,000 more nurses, 8,000 more GPs, 5,000 more social carers and 3,000 more midwives into the NHS system. And we will guarantee you that 48-hour time period for a GP appointment, which was torn up by the coalition, and we will guarantee you the results of cancer testing within 1 week. In terms of the health campus, we stand on a position locally, well I stand on a position locally that I support the farm terrace and not the holidays. The Trust had said that it was possible to deliver the health campus without the use of that allotment land. Now, he did say, in the interest of fairness, he did say that it would make it harder to deliver it because that land is quite valuable to the development part of the health campus. But nevertheless, I think it shows a really regrettable lack of imagination and political will not to try and deliver this, retaining the allotments, which provide so many benefits to the people who use them in terms of exercise, the food that they're growing, how healthy that is, and so on.
Okay, thank you very much.
The health campus part first. The NHS there's the fact that the Health Trust is in debt. Is it local government status? Is it government status coming together and nothing being done? In terms of the NHS, Cast Iron Dave said in 2010, when I get into power, there will be no top-down reorganisation of the NHS. As soon as he got into power, there was a top-down reorganisation of the NHS. I think we need to have a sensible discussion about the NHS. I think it's too management heavy, too top heavy, and I think that the NHS to work, we need less people in the NHS pushing paper and more people treating patients. So UKIP policy is to invest on front-line staff, an additional £3 billion, which will help the Watford Hospital, will help our hospitals across the country. And that is our start. Farm Terrace would not be built on if I was your MP.
The question that was put forward. You can make your mind up the other stuff, but election times, it's like take your pick, isn't it? We'll spend 8 billion more, 6 billion more, 3 billion more, 5 billion more. Anyone can say, because I again saw the situation 5 years ago, and I spent a lot of time doing what I can to alleviate a position where the demands on the NHS, like everything else, like we talk about education, are much more than anyone ever predicted them to do. Now, as far as GP surgeries are concerned, it's now 7 surgeries, it's expanding, and the technology is there so that in each area, if you go in, it's not your surgery, it's a nearby one, they've got the medical records and everything like that. That's 16,000 extra GP places. Yes, as Nick said, I said last night there's no proposal for a new hospital from the Hospital Trust. There isn't. Meanwhile, 5 new wards have been opened in the last 5 years. Just so that people know, and I didn't know this before, it's gone up from 260 million to 310 million in the last 5 years. As far as the health campus is concerned, I'm fully in support of the council's policy. I think it's the gateway to a fantastic urban regeneration scheme and the development, I hope, of a new hospital on the site. But it does seem to me that that land has got to be part of the redevelopment of the hospital trust.
Speak for your constituents, not against them.
From the floor.
I think that when we are speaking with regard to the allotments, you know, if there are two sides to a story, you actually have to take one side, so you can't speak, you've got to speak one against the other. 12 years ago, I was taken to the top of the Princess Michael of Kent building by the then Chief Executive, David Laws. He looked down and he said to me, we've just had a health and safety report on this building, it's in a terrible state. There was a proposal on that land for a warehousing development, which frankly in opposition we opposed. It was very low value, giving very little in jobs and in regeneration. I went back to the council and actually said, they went down, they came back and said, not only can we help the hospital in the future, but we can actually have a significant regeneration down there that will be considerably better than a load of warehouses. What I have done is kept the door open for our hospital to improve, expand off its footprint. You can't knock down Princess Michael of Kent unless you've got something built in its place. The decision to include the allotments was a difficult one. Nobody would want to upset a group of residents who actually care about what they do, which is why the allotments will be completely replaced, why the allotment holders will be offered new sites, new sheds and compensation of £1,000 in order to facilitate their move. The new finance director actually said Health Campus will be built in 7 years, and there will be jobs, there will be homes, there will be more public open space than currently exists down there. Allotments are not public open space. The road is significant, it's being built now.
Thank you very much. I'm well aware as we all are that the opinions run high on this particular topic as with others. So can I ask our lady at the front there just to make a comment, an observation, please?
I agree, we agree completely. If we thought that the hospital was in any way or in any shape position to go ahead and desperately needed that allotment land, we would give it to them. So what we're saying is hold off, wait, all the candidates, because this can be changed, wait until you know that the hospital are definitely in a position where they need the land, and then apply for the deregulation.
Thank you very much.
So my mum's actually been a GP in Watford for 20 plus years, and we quite often at the dinner table get all the effing and blinding about how whatever party's in charge, the approach on the NHS is completely wrong. My mum's words, not mine. What we really need is a huge national health campaign to educate people how to use the NHS, not parties randomly chucking more nurses and money at it. We need a huge, great big health campaign to educate people how to use the NHS. What does each party think about that?
Okay, thank you very much for that.
I mean, I think you're absolutely right. I go to GP surgeries myself. I see people there for all sorts of reasons, varying from really serious to quite trivial ones. And I think people do need a lot of education in what to go where and why.
Our hospital is in a mess. It's had its recent inspection, and believe you me, we're not going to come out of it smelling of roses. The hospital has actually been declining in many ways for about the last 20 years.